You're listening to a brief excerpt from the Financial Case for a Frictionless Experience, co-sponsored by Advisory Board. During this webinar, you'll learn more about the frictions that highly impact cost of care use, satisfaction, and retention, factors that drive patients to use costly care, and where to prioritize your experience improvement initiatives.
Hi, good afternoon, everyone. As mentioned, my name is Rachel Sokol, and I lead payer research at the Advisory Board. For those of you that aren't familiar, the Advisory Board is a healthcare research firm based in Washington, D.C. We work with a number of different constituencies, but I lead our work with health plans, and I'm excited to be sharing some of our latest research, in particular, our latest survey around how plans can help members have a much smoother and much more enjoyable member experience. So we'll spend the next about 45 minutes or so in these three sections. We start with what we call the never-ending experience problem. So how do we see plans thinking about their consumers' experience? What are some of the investments that they see making, and where do they see those paying off or otherwise? We'll spend and then in the second section, the case for the frictionless experience, we'll spend some time talking about how those specific frictions, those little things or sometimes big things that members encounter, how they impact the different metrics that plans are held accountable for. And then finally, we will spend most of our time in that third section going over 4 big insights from our survey, where we think that plans can really use this information to do things differently, and we'll share a few case examples from organizations we work with that illustrate some of the potential solutions. So we start here, and what here I'm showing is Net Promoter Score data for different types of industries. And the information here is not going to be a surprise to anyone in the health plan space. Health plans have a Net Promoter Score, which is a measure of how strongly an individual would recommend you to a friend or colleague or family member. Health plans have a Net Promoter Score a little bit over airlines, a little bit higher than telecom, but still pretty far short of some of the larger consumer brands that we see, like Amazon and Netflix. And while health plans have improved in years past, we have a Net Promoter Score of 19 compared to 18, where we were a couple of years ago. These are incredibly small and incremental improvements, and I think the quote on the bottom says it best, that these small improvements that the best insurers have made are not going to be good enough to win, serve, and retain customers in the long run. So plans are really facing an uphill battle to show that they can do things differently. And I spend a lot of my time talking to different health plan executives across the country, and one thing that I hear that just continues to be really frustrating is that it's not like organizations aren't spending a lot of time and effort here. This is not a new problem. It's one that plans have been looking at for a number of years. But despite spending more money, like we see on the left-hand side, increases in PM expenses as well as increasing as a percent of premium. Despite spending all of this money and despite it still being a top-of-mind issue for organizations, you can see in the top right, consumer experience is the number one thing that payer executives say is a big focus for them across 2019 and 2020. What I find most interesting is that it's actually above organic growth. And on the bottom are just a number of things that we see plans spending money on. So high-touch concierge services, new tools, and predictive analytics, a lot of effort in journey mapping, apps, loyalty rewards. We see plans spending a lot of time and investment here and building what we consider are very comprehensive journey maps of all of the different places that a member may encounter trouble, and then designing solutions that are meant to address those problems. But what we hear from organizations is that it really just gives them a very long to-do list and doesn't translate into any meaningful action for the membership that they have. So we wanted to design a survey that let us prioritize a number of the different pain points that plans could address. So we asked a very simple question, which is, which of these member frictions correlate with costly care use?
You've been listening to a brief excerpt from the Financial Case for a Frictionless Experience webinar presentation. This webinar was co-sponsored by Advisory Board and recorded on February 12, 2020. You can watch the full webinar video by going to the link that appears now on your screen.